In this video, we'll be talking about loading and implantation of IPCL. And this is how the IPCL V2 model looks like. And it could be very confusing with so many holes for the beginners to load the lens. So the first thing we should pay attention at the convexity of the lens. The convexity should be facing upwards, and the two paracentral holes which are there on the optic edge should be towards the upper eyelid of the patient. Having placed that, next thing you should look at are holes on the haptics. There are 4 holes in the haptics, and 2 are circular and other 2 are heart shaped. The first heart shaped hole should be towards the left leading haptic, and the second should be towards the right trailing haptic. Once you have identified all these holes, the lens is ready to load in the butterfly cartridge. The lens should be loaded with PSS and small amount of HPMC. The lens should be tucked slowly in the butterfly cartridge while closing it, and at the end it should be checked for the free movement inside the cartridge with the instrument. Once the lens is loaded, we are moving towards the patient's eye. 2 paracentesis are made. Visco is injected inside the anterior chamber. The care should be taken that the anterior chamber should not be overinflated with the visco, and we are slowly injecting the lens into the nozzle of the cartridge. Care should be taken that the injection should not be fast, otherwise the lens get rotated inside the cartridge. While injecting it in the anterior chamber, we should not aim directly for the sulcus, and while injecting, one should continuously look for the holes on the optics. While unfolding, the right side haptic should show the circular hole, and left side haptic, that is leading haptic, should show the heart shaped hole. That is how you confirm that your lens is unfolding correctly. Once the lens sits inside the anterior chamber, the visco is injected over the lens to press it down, and with the manipulator, all 3 haptics are slowly tucked behind the iris. When all 3 one-sided haptics are behind the iris, the lens is rotated so that the axis coincides with the corneal axis, which is marked with the 26 gauge needle, and the other set of haptics are tucked behind the iris. Once that is done, the thorough visco wash is done. It is important to take out the visco from behind the lens. For that, I keep irrigation port near one hole and the aspiration port near another hole. Usually you can see these strings of visco coming out of the holes, which is near the aspiration port, but it is very important not to block the hole with the aspiration port, otherwise the anterior chamber will get sucked into the aspiration port and it might cause the cataract. Finally, the ports are hydrated and the case is closed. Thank you for your attention.